in the corner, and her whole body was distorted.
Honestly, I would have rather had somebody tear my eyes out than look at my daughter on this table.
Danielle's stomach was round. She looked like she was pregnant as a baby.
The thing that we did the most was pray.
Next, two medical mysteries that defied the experts. Heather and Todd Tallarico could never have prepared themselves for what would happen to their only daughter when a seemingly ordinary childhood illness suddenly spirals out of control.
I was helpless. I felt like I was losing my daughter.
Then, Pam and Dave Barquette can't wait to bring their newborn daughter home, but they are completely unprepared for the terrifying series of medical emergencies that will literally take over their lives.
I really thought she was going to die. I just was gonna say goodbye.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. In January of 1995, New Jersey natives Todd and Heather Tallarico brought their daughter Gabby home from the hospital. It wasn't an easy first few days for the new parents, but they did their best to learn the ropes.
I was young, I was 24, and I was overwhelmed. But to have a new baby with my husband, we were ecstatic and elated.
It was just the best feeling I could ever have, except for having my own children.
Gabby was the first grandchild, so there was a lot more pomp and circumstance.
Slowly but surely, the Tallaricos begin adjusting to life as a family of three. It's a joyful time for them as they get to know their little girl. But when Gabby is 6 months old, they notice something unusual on her skin.
The rash would appear kind of blotchy. There was no real symmetry to it. So it was this mystery rash.
Of course, being a nervous mom, I took her to the pediatrician and inquired about it.
But as soon as the pediatrician sees the strange rash, he assures Heather that there is absolutely nothing to be alarmed about.
The pediatrician said, it's no big deal. It's probably eczema. It's common in young babies. So just don't worry about it.
He suggests that they try treating it with an over-the-counter ointment and even try changing their laundry detergent in case she has sensitive skin. But nothing they do seems to help.
But we really couldn't find any real diagnosis to what the problem was, and neither could the pediatricians. So there's a lot of just, let's see where it goes.
But then, in July of that year, the family moves into a new house. And suddenly, the rash disappears. The concerned parents breathe a huge sigh of relief.
The condo that we lived in New Jersey was an old condominium, had forced hot air. We had never cleaned the ducts. This house had baseboard heat. She must have been allergic to something in the house. And sure enough, the rash never reappeared.
But as they settle into their new home, Heather begins meeting other mothers, and she soon notices that Gabby seems to get sick more often than other infants her age.
My family would comment all the time, gee, Gabby has another sinus infection or ear infection.
And almost every time she comes down with something, her temperature seems to skyrocket to 103 degrees.
The doctor just says it's just normal childhood diseases, and it's just the course the children have to take to get their immune system built up. At that time, it was a good enough answer for me because I didn't know any better.
We just said she was a sick little kid. She has a tendency to catch things a little bit more than everybody else does.
Heather and Todd do their best to stay calm each time Gabby gets sick. And over the next year, she seems to be growing like any other toddler. She's into everything, and her teeth are coming in. But when Gabby turns 2, the Tallaricos begin noticing something very peculiar about her new teeth.
I noticed there was white spotting, which they actually called decalcification. I worked for Colgate at the time and was very aware of dental development.
The pediatric dentist told us she had low enamel coverage on her teeth, probably because of the high fevers. And we said, okay, we understand that, and because she did have high fevers. So every 6 months, we had to get coatings on her teeth to make them stronger.
Over the next 4 years, Heather and Todd try to come to terms with the fact that Gabby's simply the little girl on the playground who's most likely to catch whatever's going around.
You know, outside of being sick a lot, she was a chatty little young lady. She was growing. You know, we thought, okay, you know, things are starting to look okay.
Then, on a hot summer day in 2001, 6-year-old Gabby tells her parents once again that she isn't feeling well.
And I said, you know, lay down on the couch and, you know, just relax.
I took her temperature and it was at 103. So I said, okay, go rest. I'll put the TV on and I'll be right back.
But nothing could have prepared the Tallaricos for what they would find when they came back into the living room.
Her back was rigid, her eyes were rolled into the back of her head. Fear, could she breathe? I literally just grabbed her, I picked her up, and we raced out the back door.
Pam and David Barquette were busy preparing their New Jersey home for their first child, a baby girl.
We found out she was a girl, which is really what I wanted, and I was so excited. I couldn't wait to go shopping.
I was overjoyed. We fixed up a brand new room for her.
It was a positive time.
With her pregnancy going smoothly, Pam eagerly looks forward to each doctor's visit to learn how her baby girl is doing. But at her 8-month checkup, a routine blood test reveals something out of the ordinary.
All the prior ones were normal, but this one wasn't. It was the alpha-fetoprotein one.
This standard test checks the levels of protein and hormones being produced by the fetus. High levels of alpha-fetoprotein can often indicate a birth defect. It's the last thing the Barquettes ever expect to hear.
They said it could be just a false positive, or it could be Down syndrome.
I didn't know if I was special enough to have a special child. Most people have the anticipation of having a normal child.
I was so scared, I didn't know what was wrong.
As a next step, the doctor performs an amniocentesis and an ultrasound to confirm the findings.
The amniocentesis test was slightly high, but after the ultrasound, they told me everything was fine. She had all the correct organs. There was nothing wrong with her, so I was very relieved.
1 month later, on May 31st, Danielle Antoinette Barquette is born, weighing 6 pounds and 6 ounces.
First time I saw her, she was like a little peanut, tiny. She was really, really small, but very, very beautiful.
The doctors came, they handed her to me. She was fine. There's nothing wrong with her.
Relieved that Danielle is healthy, Pam and Dave take their daughter home and start settling into their new role as parents.
Danielle was an excellent baby when I brought her home. She'd sleep, she was happy.
She was just as cute as a button. She was really an adorable child.
But just days after bringing Danielle home, Pam and Dave begin noticing a disturbing pattern.
Feeding her was always a chore. You give her a bottle, no matter what time it was, she'd throw it up. So you give her more, she'd throw it up. Some would stay, some wouldn't. It was just a problem to feed her.
I just figured this was normal, how kids act. Most kids throw up until you get them on the right type of formula or get something that doesn't irritate their stomachs as much.
The Barquettes stock up on various types of formulas to see if Danielle can keep any of them down, but none of them seem to do the trick.
Feeding her came to be clockwork after a while, because we knew that as soon as we gave her the bottle, she was going to throw it up.
Not only is she throwing up after every meal, Danielle is starting to experience daily bouts of diarrhea. But Pam is even more troubled by the fact that her 3-week-old daughter seems to weigh about the same as the day they brought her home.
She wasn't really gaining weight. I realized there could be something wrong, and that's when I brought her to the pediatricians.
The doctor gives Danielle a thorough examination and isn't alarmed by her condition. She reassures Pam that her daughter probably just has a sensitive stomach and that she should grow out of it in a few weeks.
They said, well, we'll keep an eye on it. Next visit, we'll see what happens. I was happy with the answer the doctor told me because I didn't want anything to be wrong with her.
Over the next 3 weeks, Pam is hopeful that the chronic vomiting will start to taper off, but it doesn't. Meal after meal, she throws up. When Pam takes Danielle in for her 2-month checkup, she is expecting grim news and anxiously waits for the doctor to weigh her.
She did gain weight. Not a lot, but a little. So I assumed that it would just keep going up from there and that she would be fine.
Relieved, Pam continues to monitor Danielle's growth. And slowly but surely, she continues to gain weight. But when Danielle is 3 months old, the entire family notices an altogether different and bizarre symptom.
It was my father's birthday, and we were chatting like most families do.
I mentioned how Danielle was growing. And my son-in-law said, yeah, but it's a little funny.
My husband noticed she was checking on her, that her stomach looked really big.
He lifted up her little outfit, and her stomach was distended.
Danielle's stomach was round. She looked like she was pregnant as a baby.
When Heather and Todd Tallarico witness their 6-year-old daughter experiencing a terrifying seizure, they immediately put her in the car and race her to the nearest hospital.
I was scared to death. They rushed her in right away and they started working on her.
They put her on a IV drip to try to get her out of the seizure.
She was running a high fever. They just monitored her as she came out of the fever.
While the Tallaricos are waiting for someone to tell them what's going on, they're praying that the seizure hasn't caused any long-term damage to their little girl. Finally, after what feels like an eternity, the medical team returns with a diagnosis.
They came out and they said, you know, Mr. and Mrs. Tallarico, your daughter probably had a febrile seizure.
A febrile seizure is a convulsion triggered by a sudden spike in temperature that often occurs when an infection spreads through the body.
They said most children have febrile seizures between the age of infancy to 6. You know, Gabby's 6, so it is kind of rare that she'd have her first seizure at this age, but not uncommon.
Doctors treat Gabby with fluids and medication to bring her fever down. And within a couple of hours, she seems to be returning to her normal self. The doctors assure Heather and Todd that in most cases, febrile seizures aren't nearly as dangerous as they look, and Gabby's dismissed from the hospital the next morning. Over the next year, she doesn't experience any seizures. In fact, she seems to be as healthy as her classmates and completes first grade with flying colors. But then, one afternoon, when Gabby is feeling a little under the weather, her body very unexpectedly shuts down on her. Once again, she begins convulsing uncontrollably. In a state of panic, the Tallaricos again race their daughter to the hospital.
We were surprised because we were thinking that these seizures are going to go away because she's getting older.
They ran blood tests again. They gave her an IV drip.
They started also saying maybe we should rule out epilepsy.
Heather and Todd watch helplessly as the medical team performs a battery of tests to find out whether or not Gabby is indeed epileptic.
With all these monitors coming off her head, she looked like some creature from outer space.
As a mom, I need an answer what's going on with my daughter's health. I'm frustrated.
After an agonizing wait, the findings finally come in, leaving the Tallaricos with more questions than answers.
All the tests come back negative. This neurologist actually said, well, there are people that have febrile seizures beyond the age of 6. There's a good chance that she could just have febrile seizures.
Completely traumatized by the 2 seizures, the worried parents begin compulsively monitoring Gabby's temperature. They're confident that if they can catch a fever early enough, they'll be able to prevent another seizure.
We bunkered down into the house, laid out all the meds.
My husband and I would take shifts to make sure. We would set our alarm clocks to get up in the middle of the night to check on her if her fever's spiking.
We were scared parents because we'd seen two, and we never wanted to see, we didn't want to see any more.
Now their lives are completely centered around keeping a watchful eye on their only daughter's health. But then one morning in February of 2006, when Gabby complains she's not feeling well again, her parents come face to face with their greatest fear.
I came around the corner, and there she was, having this seizure. And this one was really bad. She was frothing. Her whole body was distorted. It was horrible. You could just see it was so much more severe. I immediately dialed 911.
Todd called me. He was hysterical and said that Gabby has gone through the worst seizure ever. We've almost lost her.
Biggest issue I thought was I was losing my daughter. I thought she was going to die.
3 months after Pam and Dave Barquette bring their newborn daughter Danielle home, they're sent into a state of panic when they realize that her tiny abdomen has nearly doubled in size. Pam immediately takes her in to the pediatrician, who is also alarmed by what she's seeing.
They looked at her and they said that she could have a hernia.
Danielle's stomach could be protruding because of a hernia, a bulge that occurs in the abdomen when an organ is out of place. If left untreated, hernias can cause irreparable damage to vital organs. The only way to confirm her suspicion is to admit Danielle to the hospital, where they can run diagnostic tests. It's the last thing Pam ever expected to hear.
I started to panic. I called my husband.
She goes, there's a problem with Danielle, and they're sending her to a specialist at Morristown Memorial. And I basically just dropped everything I was doing and just left.
And they rushed us to the hospital with her. And I had a surgeon meet me in the emergency room.
The pediatric surgeon immediately orders blood work, a CAT scan, and x-rays. As ER staff whisk their only daughter away, all the Barquettes can do is wait helplessly.
She's screaming and crying because she's scared and she doesn't know what's going on. It's just a scary thing to see that.
It was my instinct to want to be with her, but I knew that they knew what they were doing.
2 long hours later, the test results are in. Danielle does not have a hernia.
When they told me it wasn't a hernia, I had no idea what was wrong with her.
As Pam and Dave struggle to process this latest development, the team reviewing the CAT scan has figured out what's causing Danielle's distended stomach. Her abdomen is filled with ascites, a catch-all term for any fluid that builds up between the abdominal wall and the internal organs. They speculate that the fluid has been slowly accumulating over the past 2 months, explaining why Danielle was gaining weight, even though she couldn't keep anything down. Suddenly, the Barquettes realize just how sick their newborn daughter has been all along.
We're not doctors, we're parents, and it comes with no instruction manual.
At that point of our journey with her, we had no idea of what we were facing.
The news is worse than the Barquettes ever could have imagined. The ascites is slowly crushing Danielle's tiny lungs. If doctors don't act fast, the fluid that's accumulating could stop her from breathing.
My biggest fear is that Danielle was gonna die. And it was very hard, because I didn't know.
The team rushes to drain the excess fluid by inserting a catheter into Danielle's tiny abdomen.
I'll tell you honestly, I would have rather had somebody tear my eyes out than look at my daughter on this table.
But right away, the procedure seems to be working, and for the moment, Danielle is out of danger.
They were able to stabilize her once they drained the fluid out of her stomach.
Now that they have stabilized her, the team can focus on pinpointing what is causing the ascites. And despite their initial sense of relief, the Barquettes settled in for the longest night of their lives.
I spent the night in the hospital because they wanted to run more tests. It was a long day. I was tired. Sleeping was not an option.
How could you sleep? You know, you don't even know what's wrong with her.
All I did was watch her all night. I couldn't really hold Danielle because they had IVs connected to her. So I would just stand over her and touch her little face, her hand.
The thing that we did the most was pray.
The next morning, when the doctors check in on their tiny patient, they're shocked by what they find. For the second time in 24 hours, Danielle's abdomen is full of the deadly fluid. Once again, the clock is ticking, and the medical team begins running a battery of tests in a frantic effort to figure out exactly what's going on.
I had every specialist, resident, coming in and out of our room because they didn't know what was wrong with her.
I believe that they started out with the basic things, obviously blood tests and urine tests and things of that nature, trying to rule out if there was any levels that were way off the chart.
But as each test comes back, result after result shows that Danielle's heart, lungs, kidneys, and liver are all normal. For the next 3 days, the barrage of tests continues with no new leads. Desperate for answers, the Barquettes begin to wonder if anyone will be able to save their little girl.
I would think, oh geez, what's next? They've done all these other tests, they still haven't found it. What could be left?
With Danielle's condition rapidly deteriorating, the hospital calls in gastroenterologist Dr. Joel RASH.
Every minute counted. It was that type of situation. You feel pressure to make a diagnosis and hopefully effect a cure yesterday.
Shook my hand and said, let's see if we can't find out what's wrong with her. I think he immediately went over. I think he put his hand on her head. I'll tell you what, it meant a lot to me.
A specialist in digestion and liver disease, Dr. RASH is deeply troubled by what he sees.
She was obviously a very ill infant. Her abdomen looked like one of those old-fashioned Jiffy Pops. That is not a good sign.
He immediately suspects that her liver is shutting down, causing the fluid to build up.
The most common cause of ascites, certainly in adults, is from the liver.
But so far, all Danielle's liver tests have come back normal.
Even though her typical tests of liver chemistries were not suggestive of a significant liver problem, the question was, could this be coming from the liver anyway?
Determined to flesh out his hunch, he delves straight into Danielle's chart, scrutinizing every test they've run on her in the last 5 days. And it takes him only moments to notice one important test that has yet to be performed.
The best liver test that we have to tell me is the liver working is a test of clotting. That had not yet been done.
One of the most important functions of the liver is to create proteins that cause our blood to clot.
Once the liver begins to fail, the proteins that need to be made to allow for normal clotting are no longer made, and so the blood clotting test will become abnormal.
And just as Dr. RASH suspected, the test results are the first real breakthrough in the case.
They were markedly abnormal, which was a sign to me she was in severe liver failure.
This is the clue that Dr. RASH has been looking for, but the revelation also means that Danielle is sicker than anyone had ever imagined.
I really thought she was going to die. I just was going to say goodbye.
In a state of panic, Todd and Heather Tallarico have just called 911. Their only child, 11-year-old Gabby, is experiencing a seizure like they've never seen before.
In the past, she would just come out of the seizure. This one, she wasn't coming out of.
I was helpless. I didn't know what to do. I felt like I was losing my daughter.
When the ambulance finally arrives, the Tallaricos watch helplessly as the medical experts take charge.
When they got her gurneyed and into the ambulance, they had to inject this drug into her to get her to come out of the seizure.
Sign cop from 6112.
After a nerve-wracking 15-minute drive, the ambulance arrives at the hospital and rushes Gabby into the emergency room.
They're really moving fast, got doctors over. All of a sudden we hear she's got a high fever, and we're thinking, oh great, you know, this is another febrile seizure.
While Gabby's family does their best just to keep it together, the medical team focuses on finding out what could have triggered the horrifying seizure. They run test after test, looking for some clue.
You see your granddaughter laying there, and there's nothing I can do. It's just, I wouldn't wish it on anyone. It's a terrible, terrible feeling.
When blood test results come back, the doctors do seem to have discovered a critical lead, but it's not good news. Gabby has a shockingly low calcium level. Most people have a calcium level ranging between 8 and 11. Gabby is registering a 5. A level this low is a sure sign that something is very wrong. Calcium is not only essential for strong bones and teeth, it also plays a critical role in the functioning of the heart and muscles. In the worst cases, severely low calcium levels can cause the heart to stop beating altogether. Suddenly, the clock is ticking, and doctors immediately move Gabby into the intensive care unit.
All of a sudden, this calcium problem, which we had never heard about before, was called to the attention. So all of a sudden, everybody's coming in. And that's the first time we met Dr. Cerami.
Pediatric endocrinologist Dr. Barbara Cerami immediately performs a head-to-toe exam.
When I saw her, she wasn't actively seizing. She does have the facial twitching, and her hands were definitely stiffened and clawed.
These are all critical clues, and after carefully reviewing the tests performed earlier that day, Dr. Cerami has a strong suspicion as to what's wrong with Gabby.
With Gabby, because of her age and from the history that we had gathered, it is most likely that this will be hypoparathyroidism.
Hypoparathyroidism is a condition in which the parathyroid glands located in the neck aren't functioning properly. In a healthy individual, the glands release the parathyroid hormone, which regulates how much calcium the body can store. In Gabby's case, her calcium levels are extremely low because her parathyroid glands are failing to release enough of the essential hormone.
And we were like, excuse me? What is that? You know, she said most likely she has a deficiency where her body is not absorbing and utilizing calcium.
Suddenly, seemingly unrelated symptoms begin making sense to the Tallaricos as Dr. Cerami walks them through how hypoparathyroidism affects the body. Whenever Gabby's calcium levels became too low, her body would experience what's called a hypocalcemic seizure, a neuromuscular reaction to the lack of calcium. Even Gabby's dental problems can now be explained. The low levels of calcium also resulted in weak enamel on her teeth.
We thought she just had a febrile seizure. Now all of a sudden things are starting to click.
And saying, hey, okay, now we're getting a diagnosis, we understand.
Dr. Cerami immediately begins treating Gabby with a seemingly simple therapy, an IV of highly concentrated calcium. For the next 5 days, the Tallaricos watch their little girl regain her strength. During this time, they also begin learning how to manage Gabby's calcium levels at home with medication.
To me, it was, you know, okay, I can live with this. And if we can prevent those seizures by her taking pills, I'm all for it.
But just when her parents think they have a solid diagnosis in hand, Dr. Cerami warns them that they're not out of the woods yet. There is a critical missing piece to the puzzle that she still has to find.
When we make a diagnosis of hypoparathyroidism at her age group, it is often unlikely to be an isolated condition. More often, there are other associated autoimmune problems. The challenge was to identify what was causing the hypoparathyroidism.
Before Gabby is released from the hospital, Dr. Cerami draws more blood to test for other potential autoimmune problems.
Gabby was doing well, so we're like, okay, she'll call us. I'm sure they're going to be negative. We found her diagnosis. We're happy with that.
Confident that Gabby has been through the worst of it, the Tallaricos head home and wait for the lab results. Nothing could have prepared them for what the tests would reveal.
We found out that, yes, indeed, she doesn't only have hypoparathyroidism, but there are other autoimmune problems involved.
Now, all of a sudden, what we thought was a good situation moving in the right direction now all of a sudden was like, oh my God, we're back to square one again.
For the past 5 days, Pam and Dave Barquette have watched more than 30 doctors struggle to save their only daughter's life. Now, gastroenterologist Dr. Joel RASH thinks he knows what's causing her stomach to fill with a deadly fluid called ascites. Her liver is failing, and he suspects he knows why.
There are not many things that would put a 2 to 3 month old in severe liver failure. And then putting together the fact that she had basically normal tests that look for inflammation of the liver, I knew I had a relatively non-inflamed liver that just wasn't working. That smells a lot of very rare condition.
To prove his theory, he turns to Pam, hoping that she can provide a vital piece of information.
One of the markers is a very high alpha-fetoprotein. Knowing this is what made me ask the mother if she had ever heard anything about alpha-fetoprotein. And she sort of gave a laugh and said, "Oh, come on, someone must have told you that story." And I asked her what story, and she told me the whole story about the obstetrician and the elevated alpha-fetoprotein.
Dr. RASH immediately orders an alpha-fetoprotein test for Danielle. And the results are the last piece in the puzzle.
The alpha-fetoprotein is a protein that comes about from damage to the liver. And normal alpha-fetoprotein in an infant may be several hundred. Hers was 77,000. And seeing that level of elevation is almost diagnostic. We were dealing with tyrosinemia.
Tyrosinemia is a genetic disorder caused by the lack of an enzyme needed to break down tyrosine, an amino acid that is found in most foods high in protein, like meat, eggs, and dairy.
Infant formula, the regular formula, breast milk, anything that an infant will be eating has protein, and those proteins have tyrosine in it.
If patients with tyrosinemia continue to eat these proteins, toxic levels of tyrosine will build up in their system, poisoning their body.
Every time Danielle ate, she made herself sicker.
This explains her vomiting and diarrhea.
It started making sense. She couldn't tolerate the formula because she didn't have the enzyme to break it down.
In Danielle's case, her tyrosine levels were so high, they actually started to poison her liver. In response to these toxic levels, her failing liver quickly became unable to process fluid normally, causing her stomach to fill with deadly amounts of ascites.
Untreated tyrosinemia is uniformly fatal. So in a sense, the ascites did her a great service, because I don't know that we would be talking about Danielle the way we are today had she not gotten that swollen belly and sort of called attention to herself.
All the pieces came together. I was relieved. At least I knew what I was dealing with.
The Barquettes are thankful to finally have a diagnosis, but they still can't help but wonder why more than 30 doctors missed the critical clue.
One of the curveballs that tyrosinemia can throw, the liver doesn't get destroyed. In a sense, it gets poisoned. So the tests that would tell me about abnormal turnover or death of liver cells don't clue me into a liver problem.
In addition, because tyrosinemia is so rare, only 1 in 100,000 children in the United States are born with it, it's not included in the wide range of tests medical experts usually run to assess the liver.
It's very rare, and most doctors have never seen it. I was very lucky that Dr. RASH saw this other case.
I diagnosed a child with tyrosinemia about a year or two prior to Danielle. So those clues don't have to be quite as loud or quite as large if you've already seen a case.
He knew exactly what to do and how to handle it.
With a diagnosis in place, Dr. RASH begins treating Danielle with an experimental new drug called nitasinone, or NTBC.
After he was confident that it was tyrosinemia, he let us know that there was a company in Sweden that developed an experimental medicine that could help trick the liver in the processing of protein.
Within days of the diagnosis, Dr. RASH administers the first dose of NTBC, and almost immediately, Danielle's life begins to change.
Once the NTBC, once the medication, which helps reverse the whole process, was given, within days she had a marked improvement.
She was eating and her stomach wasn't holding fluid anymore. She just seemed to be more alive. It was just, I knew she was going to be okay.
After 2 long months, Danielle is finally out of danger, and Dr. RASH expects that with the proper treatment, she'll be just fine.
For the rest of her life, Danielle needs a special diet, which is low in the amino acids, especially tyrosine, and she requires the medication NTBC, which is now FDA approved and available in this country.
After suffering for more than 11 years from severe seizures, significant tooth decay, and frequent fevers, Gabby Tallarico has just been diagnosed with hypoparathyroidism, a rare condition that prevents her body from storing calcium.
It was kind of good news because all of a sudden we could put a name to something that was causing this.
But just when they think Gabby is in the clear, pediatric endocrinologist Barbara Cerami discovers that Todd and Heather Tallarico's only child also has an alarming autoimmune disorder that could wreak havoc on her already fragile body.
Autoimmune disorder is basically the body producing antibodies that see its own self as being its target. So essentially, your body is attacking itself.
And she says, well, we did confirm the hypoparathyroidism. However, the series of tests that we ran found an antibody in her adrenal gland.
She said her adrenal gland will eventually shut down.
The adrenal glands sit on top of the kidneys and are part of the endocrine system, which regulates the body's hormones. In Gabby's case, the antibody present in her adrenal glands is not attacking them yet, but could start at any moment.
An antibody attacking your adrenal gland is a very serious condition. Your adrenal gland makes hormones necessary for maintenance of blood sugar as well as maintenance of blood pressure.
Now that she has confirmation that Gabby's adrenal gland is definitely involved, Dr. Cerami believes she knows what has been at the root of all the little girl's problems from the day she was born. There is only one question that needs to be answered in order to prove her theory. Did Gabby ever experience a chronic rash?
Gabby had candidiasis as a child, which was the mysterious rash, which we were all trying to find out what it was, which made sense.
The combination of these three conditions, the hypoparathyroidism, the adrenal gland antibody, and the candidiasis, confirms that Gabby is suffering from an extremely rare genetic autoimmune disorder that only 500 people are diagnosed with each year.
I diagnosed Gabby with APS type 1, or autoimmune polyglandular endocrinopathy type 1. APS type 1 is a rare condition where basically there is failure of organs to function because of formation of antibodies attacking different organs.
Depending on how APS type 1 manifests, it can ultimately lead to diabetes, celiac disorder, anemia, or hepatitis, among other diseases. This, on top of the adrenal and parathyroid gland failure, can make APS type 1 a very complicated disease.
If it goes undiagnosed, it could be fatal, especially if the adrenal involvement is not diagnosed.
The Tallaricos are fortunate to have caught Gabby's APS type 1 in time, but they still face many unknowns. Because the endocrine system is so critical to all of the body's functions, there's no way to predict just what will happen down the road.
My fears for Gabby's health is the unknown, not knowing what can manifest.
Any other disorder, you usually know where it's going to go. This is one of those where we don't know.
But while there is no cure for APS type 1, by monitoring the adrenal and parathyroid glands on a regular basis through blood tests and medication, Dr. Cerami is hopeful that they will be able to help regulate the hormones they produce.
Going forward, to maintain her health, she will have to be on hormone replacement for the specific deficiencies that she has, and she will also need to be monitored closely for development of other autoimmune problems.
Although the Tallaricos feel lucky to finally know what's wrong with their only child, they can't help but wish the diagnosis had been different.
I can't say I'm grateful or relieved to know. Certainly would like it another way, but I know that we can monitor her and she can live a long life.
I feel so much healthier now. I feel like a normal kid, and I have to take pills all the time, but I'm kind of used to it now.
The biggest thing I could say to any parent that's going through the questions of the unknown is dig deeper. You need to be your child's champion. And that's what we try to do for Gab, is to be her champion.
Today, Danielle is 12 years old. She's a seemingly normal 7th grader who has learned how to live with her disease.
Danielle's health is fine. She's still on a low-protein diet and the drug.
I have to take 2 pills in the morning and 2 pills at night. It doesn't make me feel different. Well, it does, but I know that they can't really change it, so.
I don't feel that this was a step backwards for us. I think this is a very special thing to happen to her because it can help other people.
In a sense, she's writing her own book. Danielle and patients like her are going to tell us the long-term effects of her therapy.
Today, Gabby is an active social preteen set on becoming a scientist or possibly a chef in the future.
She can do whatever she wants, or she's going to go to college, be whatever she wants to be, and she'll take care of herself.
Gabby has done very well. Since her diagnosis, her calcium levels have been maintained quite well.
Gabby, knock on wood, has not had another seizure since she was diagnosed.
Having a disease didn't stop me for doing basketball, soccer, swimming. Just because you have a disease doesn't mean you can't do anything. If you put your mind to it, you can do anything.
While Gabby Tallarico's family spent the first 13 years of her life desperately trying to figure out what was causing her terrifying attacks, Danielle's case has helped to prove that if diagnosed in time, genetic metabolic disorders like tyrosinemia can be successfully treated.
When babies are born in New Jersey, they test for 30 metabolic diseases, and now tyrosinemia is one of them.
Danielle is proving that each of these patients has a bright future in store.
Danielle is healthy, happy, extroverted, developing and growing like any other preteen. It's a wonderful thing to see.